Keaton Fletcher, an assistant professor of industrial organizational psychology at Colorado State University.
And I'm Mariana Arvon, an organizational psychologist who specializes in organization and talent development.
And this is Healthy Work. All right, and welcome back to another episode of Healthy Work. And I am just so excited today to be joined by another phenomenal guest who recently wrote a book. I will get out of the way and let you introduce yourself.
Thanks so much, Keaton. Hi, everyone. My name is Alyssa McGonagle, and I am an associate professor at UNC Charlotte. I teach in our industrial organizational psychology master's program, and I direct that program. I also teach in our organizational science PhD program. So I've been at UNC Charlotte for about 9 years. Prior to that, I was faculty at Wayne State University in Detroit for 5 years. So yeah, that's a little bit about me.
Awesome. Plenty of experience under the belt. And so you wrote a book called Chronic Health Conditions and Work, Proactive Strategies for Supporting Employees in Doing Well by Doing Good, which I just love the title. I would love to dive right in. And I think a great question, just to kick off this conversation that you spend quite a bit of space in the book talking about, is just what is a chronic health condition and what is disability and how are they related and distinct?
Yeah, that's such a great question. And I think it's a good place to start. And I get this question a lot. So, the way that I define chronic health conditions in my book and in my research are any ongoing physical or mental health conditions that require ongoing management or limit one's activities or both. So this also, in addition to, chronic illnesses like autoimmune diseases or diabetes or heart disease, this also includes ongoing symptoms that are not directly attributable to a disease or disease process, such as chronic fatigue or chronic brain fog or chronic pain. On the other hand, disabilities they're very similar but slightly different. They're mental or physical impairments that substantially limit one or more major life activities or bodily functions. So essentially what that means is sort of legal definition. They are also impairments that limit your activities or bodily functions. However, disabilities can be much more than just chronic health condition related. And also, not everyone with a chronic health condition is going to identify as having a disability. So they're not one for one. I will say that chronic health conditions tend to fall under the category of invisible or non apparent or concealable disabilities. People may have heard of that term, but if not, those are disabilities that are just not readily apparent or visible to other people. These are also sometimes called episodic disabilities in the research literature as well. So there's definitely some overlap, but some differences for sure.
Well, that's awesome. And I like that already you're teeing me off for my next question so well, because in the definition of disability, you reference the law. And in your book, I think, you spend a lot of space talking about how disability and chronic health conditions are impacted by laws. And, very clearly we have laws, around these experiences. And so I was just wondering, in your research and in your experience, what is the role of governments in shaping these experiences? And then maybe what are some key legal points for people who experience disability that they should be aware of?
I will start by saying that, the legal landscape appears to possibly be changing. So what I say today may not be the case, in a year or two from now. But as of right now, we have several laws that protect people with disabilities. And the most common one, one that people probably have heard of, is the Americans with Disabilities Act. And there are two major components to this. One is that organizations are required to provide reasonable accommodations to people with qualifying disabilities. And these reasonable accommodations are things that help workers continue to work and work productively. Another key feature of the Americans with Disabilities Act is that employers cannot discriminate in employment functions against people with disabilities. So what that means is they can't discriminate during hiring, during things like allocating training or development, promotion opportunities, or layoffs and firing. One important thing for people to know is that the ADA was expanded several years ago because when there were lawsuits happening, the courts were tending to side on the side of organizations and say, this is not a disability and this is not a disability. So the expanded definition of disability includes bodily functions in addition to life activities. And that's important for people with chronic health issues because chronic health issues do impact major bodily functions. So that may be helpful for people to know. Another thing that's important legally is FMLA. So people are able to take leave under FMLA, including intermittent leave that's protected under this act. And one that I didn't actually include in my chapter, my legal chapter in my book, but I do think is important for people to be aware of is the Affordable Care Act. This affects the degree to which people with chronic health conditions can actually access health insurance because the Affordable Care Act means that companies can't discriminate against people with chronic health conditions when they apply for insurance. But if provisions like that go away, then it's possible that people could be legally discriminated against. And the Affordable Care Act also protects people with chronic health conditions in other important ways. One that I can think of off the top of my head is it did not allow lifetime limits on coverage. So previously, a health plan could say, well, once you hit $1 million, that's it. You're done. We're not paying for anything more. And unfortunately, some chronic health conditions are just very expensive to maintain, and $1 million could be reached in just a few years. So, those are some sort of main ones that come to mind right away.
Thank you so much. There's so much meat there. And obviously, there's even more in the book. And I love that we got additional information here. I think the perspective around the ACA is so important. We've been living with it for 20 years now. And I think people have forgotten that, like, you could just not afford health insurance if you had disability or chronic health condition or some prior health condition before. And we certainly don't want to return to a world where healthcare is like prohibitively expensive for people who experience chronic health conditions, especially if I'm remembering correctly, the statistics in your book were like 1 in 2 people will experience a chronic health condition or disability in their life. Was that right? Am I misquoting that?
Yeah, no, that's absolutely correct. It's actually a little bit higher than that. So the most recent statistics from the CDC were 60% of US adults have one or more chronic health conditions. Those statistics were done before COVID and long COVID. So as you can imagine, we are probably even higher than that in terms of our percentages. And I am old enough to remember what life was like before the Affordable Care Act and before pre-existing conditions clauses were included in the Affordable Care Act. And I personally, experienced difficulty getting insurance coverage for myself as someone who lives with a chronic health condition. So I can tell you that it's not fun, although I know a lot of people aren't familiar with that. It's something that, it would be incredibly, I think, devastating to so many people if those provisions go away.
Yeah, absolutely. And when you were talking about the other laws too, I think some of the laws that are in maybe the zeitgeist were covered in your chapter, but in a way that clarified their use. Like you're talking about FMLA and intermittent use. The only context I'd really heard about FMLA was, needing to take it after birth or when you need care for like an ailing family member. I hadn't thought about taking days here or there because of, flare-ups and disability. And I thought that was really interesting. And similarly too, for the ADA and the expanded ADA of what constitutes, a disability that organizations have to accommodate, thinking about something like Crohn's disease, right? Of, if you need to use the restroom frequently, that's an accommodation. And that might not have been covered previously, that your employer could have said no, but now certainly you have that protection. And I think people like just aren't necessarily aware that they're protected in that way by laws at the federal level, at least in the United States, and at least today, August 20th, 2025.
Yeah, it's an important provision for sure. And yeah, it's such a good point about FMLA because people don't realize that it can be taken intermittently. I think that organizations don't like people to know this in some cases because it can cause problems in terms of attendance and trying to make sure that work is covered and things like that. But people should know that that is available to them. So, for instance, if you have a chronic health condition that requires you to get an infusion and you need to go once a week or something like that for 3 hours once a week, you could use intermittent FMLA for that, get your health condition covered as a disability and file a formal accommodation for it.
Another thing that came up as you were talking, and certainly in the book, is this notion of disclosure and identity management, because, many chronic health conditions, as you pointed out, are invisible, right? It's not like we're seeing someone who is necessarily in a wheelchair or something that, like, I think stereotypically comes to mind when we think about disability, the placard of, handicap parking, for example, right? And so what is disclosure? What are some identity management strategies? that are effective? And like, why is this so important?
Yeah, so disclosure is something that becomes a big issue for people with chronic health conditions and for other identities that are invisible or non apparent to other people. So, disclosure involves thinking about if, when, who, and how much to tell people at work about a chronic health condition, whether it's a supervisor or coworkers. And these decisions can be difficult because once you disclose a chronic health condition, you can't take it back. So once people know about it, it could be that people are thinking, oh, is this, this way that I'm being treated? Is this because I disclosed my chronic health condition? Or, I was passed over for a promotion. Is this related to my chronic health condition because now people know about it? So I think the fear of discrimination or different treatment can some cases prevent people from disclosing. Another big issue, and this came up a lot in a research study that I did of coaching for workers with chronic health conditions. The people who were being coached oftentimes talked with the coach about, like, how much do I tell them? Because I think it's important for people to be somewhat judicious about how much they're disclosing, certainly being disclosing if they want to, but at the same time just realizing like what is an appropriate amount to disclose or what's going to be the most beneficial amount for that person to disclose in that particular context and working environment given the situation. I think that on the flip side, people may really have an advantage in disclosing or want to disclose if their patterns of behavior may lead others to think that something is going on. Like, so for example, if somebody needs to oftentimes leave the workplace for medical treatment or because symptoms are acting up, they don't want other people to be thinking, oh, this person's job seeking, they're going on other interviews, or they're just lacking off, they're not a good employee. In that case, when things are becoming, I guess, obvious to other people, disclosing can help create some shared understanding and explain some of the behaviors that are happening. I will also say that disclosure can be really helpful for managers and for organizations because they can better assist an employee who has stated their needs, or at least who has opened a door for a discussion around what they need to perform to their best capacity. So disclosure, those are some of the like pros and cons to disclosure. But identity management, as you ask, I think goes a bit beyond disclosure. So people can sort of do like a partial disclosure, say, like, oh, I have a health issue, I have this thing that's going on. Or they may say, hey, I have this disease, I have Crohn's disease, or I have HIV, I have AIDS. And, it's not a big deal. Look at me, I'm living my best life with it. And sort of that can serve to destigmatize the condition and can serve some really good purposes for that person and for society in that case.
It's so interesting. And again, the book is so rich. So obviously I highly recommend people going and like reading the book, but I just love getting these snippets here and overviews. And one thing I also really liked about this book is that it is so firmly rooted in the academic literature, both your own studies as well as research done by other scholars in the field. But there was an inclusion of a theory that we don't typically think of, I think, in academia as like a quote unquote theory, but you talk about spoon theory, which originated outside of the academy. And it was so vivid and helpful for understanding some of your key points. And so I was hoping you wouldn't mind explaining it here.
Yeah, absolutely. So spoon theory was coined by Christine Miserandino, and hopefully I'm pronouncing her name correctly. She came up with it as she was explaining to a friend what it felt like to live with lupus. So her and her friend were at a diner, and her friend was asking her, beyond what I can see you going through visibly, like, what's it just like to live with lupus? And so Christine was like, well, let me try to explain this. So she grabbed a bunch of spoons and she asked her friend to think about her daily activities, like starting in the morning, getting up, getting ready, taking a shower, all that stuff, and like going through the day's activities. And each activity is going to cost a spoon. So spoons are kind of like energy. So when she explained, like, okay, yeah, I'm going to take a shower. Okay, well, that's going to take you a spoon. And if you like are having hard time with your hands that day, like maybe you're unable to use your fingers, even just buttoning your shirt is going to take you a spoon. All these things that people do during the day are taking spoons away. And, if you're not able to take your medication that day or you're not able to eat a healthy meal that day, that's also going to be costing you a spoon. I like to think of my participants from a current study that I'm doing. I'm studying type 2 diabetes and blue collar workers and service workers. And particularly for blue collar workers, people who are using their hands in conducting physical labor, sometimes outside, these people are having to plan their liquid intake. They're having to plan their food intake for the day. They're having to pack foods and water in such a way that their blood sugar won't spike. They may need to make sure that their food can survive the summer heat. All of these things take spoons. And these are things I think that people who don't live with a chronic health condition may not consider or think of. The other thing that Christine says is that sometimes people can borrow spoons from the next day, but then that leads to sort of a deficit in energy that will catch up with the person eventually. And overall, it just means that people with chronic illness, many people, have to be strategic and constantly think about their energy reserves and strategize. How am I going to use my spoons wisely today? And how am I going to make sure that I can get everything done in a day that I need to do? It's also explaining why so many participants in my studies say that they put everything that they have into their job. So all of their spoons are going to maintaining employment because they need the job, they need the money, they need the health insurance. But when they get home at the end of their workday, they are just completely spent. So there are no spoons left. And they're too tired to cook meals. They're too tired to exercise. They're too tired to socialize. They can't even think about doing things to manage their illness. So that, I think, resonates really strongly with people who are in the community. And I know that sometimes I've seen people call themselves spoonies, and it really, really caught on.
I mean, it's so vivid. And I think that, it really brought the data and the academic theories to life because, I certainly can think of parallels in our field to resources and resource-based theories. But I think that there's just something very vivid about that story of sitting at the table and grabbing spoons and talking about, being able to borrow spoons from the next day and spending all of your spoons at work. And that I think also brought up some of the topics in your book around work health conflict that I thought was just really interesting and something that we certainly don't think about enough, which I think brings me to the big question, right? Of what can we do around this? And one thing that I also really appreciate about your book is that you draw from the public health model to structure the book and really, I think, clarify what types of interventions are going to be the most impactful. And so just maybe a brief overview of what is the public health model and why should we care about the different levels of intervention?
Yeah, I think it's a helpful framework for organizing things. So, the public health model is based on primary, secondary, and tertiary intervention categories. Primary prevention is all about preventing disease, illness, or injury from occurring. So you could think of, for instance, vaccinations to prevent diseases from occurring. Secondary prevention is to prevent worsening outcomes. So, for instance, preventing diabetes from getting worse and causing other problems. Tertiary prevention is therapeutic for people who are already affected with a disease. And so I borrowed this framework and applied it to how organizations can better support employees with chronic health conditions. And the way that I applied it is thinking about primary preventive strategies being for all employees of the organization, not just those with chronic health conditions. And this would involve healthy work design to promote well-being and prevent stress, injury, and illness at work. So having good policies, practices, and management strategies. Secondary preventive activities are those can help avoid worsening outcomes for people who already have chronic health conditions. And this can include things like job accommodations, providing coaching services or mentoring for workers who have chronic health conditions. And tertiary strategies are those that are intended for people who have to leave the workplace on disability. So those would include return to work programs.
One thing that really struck me, certainly reading the book, but then also even in our discussion is how those primary interventions that are designed to prevent illness in the first place are beneficial for everyone. Like an example I think of is, and this is so silly, I think, like sidewalks where they like go down and have the little bumpy part before the crosswalk. You know what I'm talking about?
Hmm.
Presumably, I think for people like in wheelchairs, so they can leave to make it ADA accessible, but also people with like visual impairments, so they know that they're there. And my son, he's 5, just asked today, he's like, why does this exist? And I was explained, I was like, well, it's, I think for this, like legally, this is why, but also, isn't it great for us? Because like now we can get up onto the sidewalk with your bike really easily. When you were in a stroller, it made crossing the street really easy for us. And so it benefited everyone. And like even your example of running out of spoons in the day for work, I think everyone with or without a chronic health condition can certainly relate to feeling just like you spent all of your energy at work, you have nothing left at the end of the day. Certainly that's, you know, a much more frequent experience, I'd imagine, for someone with a chronic health condition or disability who has to like be much more mindful about their energy levels. But I think everyone can relate to that. And so if we designed work with that in mind in the first place, it benefits everyone. It's not just you know, for some small subset that isn't going to touch you. Not to mention, as you mentioned, at least 60% of people in the United States are going to experience a chronic health condition or disability at some point in their lives. And so I don't know, it was very impactful. And it made me think again about like the way that we discuss all of these sorts of interventions, like primary interventions at a national level, even in our field, and like where is the research, like what is really interesting, what is harder to do research on, and almost like sort of the pushback I've seen in our field about the individual level interventions of like, oh, just practice mindfulness. That's how you can cope with this. And being like, no, we need to be thinking about like these structural changes, these primary interventions. And it was one of my favorite parts of your book is that focus on, you know, certainly you cover all these interventions, but really focusing and highlighting that these primary interventions are just so important.
Yeah, absolutely. They're so important, and they're a little bit more difficult to implement because they're organization wide, and things like changes to policies and culture and leadership and structure and things like that. But they are just so beneficial for all employees, and they can prevent a lot of the downstream negative effects. So really important for sure.
If you had a magic wand, I know this is tough because you cover a lot of interventions in like great detail and go over the like empirical evidence for and against. But if you had a magic wand and could force every company to adapt, let's say like one intervention, what would it be?
It's so tough because they're all interconnected. So I pulled out a few. I don't know that I could pick one necessarily, but I think if we're talking about the United States in particular, and we're thinking about what is absolutely most critical, employees need benefits, right? We need health insurance, we need paid time off. I explain in my book why employees with chronic health conditions also need things like access to life insurance and long-term care insurance through their employers, because we are able to be legally discriminated against in the insurance market. So having those benefits access through work is absolutely foundational and critical. That's in the United States. Culture is obviously extremely important as well. And that's a close second for reasons that I'll get into in a moment. If we're going to go down the chain, job accommodations, designing work really well for workers, allowing workers autonomy and control to the extent possible is really important. And I know I'm well beyond my one, but I do have to mention one thing because this emerged so frequently in interviews that I conducted with HR professionals and leaders in organizations when I was preparing to write this book. Everyone pretty much with very few exceptions said that there is a need for leadership training on these issues. So managers are not trained to manage employees with chronic health conditions. They're not trained on how to respond to disclosures. They're not trained on what the differences are with disabilities, what the legal implications are. They're not trained on how to have ongoing conversations with employees around their health. And these are tough things to talk about. This is difficult. But as we know, one's leader, one's manager has such a huge influence on an employee's work experience. So I guess having said all of that, I would also put leadership training at the very top of the list, maybe right second to benefits. And I am also in the process of developing a leadership training right now, and I'm hoping to start testing it out in the coming months.
That brings me to another thing that stood out to me in the book is like you warn against companies doing some of these interventions if they haven't laid the groundwork with the culture, right? And so even with like leaders, for example, you mentioned like you can't put this all just on leaders in HR. if you don't have the structure or the culture to support this, right? Or you can't say that you're inclusive or say that you're accommodating or expect people to disclose if they know that like really the culture isn't going to support them. And so I guess I just want to step back and give you an opportunity to talk a little bit more about like what does the right culture look like for a company trying to support, certainly all employees, specifically employees with chronic health conditions.
Yeah, so the two pieces of culture that I talk about in my book as being really important are a valuing of worker well-being and a valuing of worker inclusion. And so, the first one, valuing worker well-being, that's, what is the organization prioritizing? And is worker well-being an actual priority beyond just lip service to that? So, are the policies reflective of valuing worker well-being? And are the policies able to be used by employees? Or are people inadvertently or advertently penalized for using policies like work from home or flex time and things like that? So, having that culture that values worker well being is so important. Inclusion is also very important because we know that disabilities can be stigmatized within organizations, and employees with disabilities do face kind of worse outcomes in terms of employment than people without disabilities. So it's really important to be mindful of inclusion and to be expansive in how we consider inclusion in considering it to be applied to disabilities as well. Sort of as one example of how like culture is important for this is like say we have an employee who has access to coaching, which is more of a secondary preventive intervention. That employee through coaching realizes that in order to maintain their health they need to ask for a modification to their job. Say for example, they need to take their lunch break at the same time every day, so that they can eat to maintain blood sugar levels or to take medication at that time. But due to the dynamic nature of their job, this means that sometimes other workers will need to step in and cover for them. So, what is prioritized in that culture? If well being is prioritized, sort of the default, I think, of managers and workers will be to work together and make this happen. And there may even be a policy to support it. So, on the flip side, if the culture is unsupportive, the employee could face pushback when they ask for that, or even backlash for making such a request. So I think the culture just is so important.
There is so much in this book that we didn't get to touch on that I think is just so interesting and important and impactful for people who want to do research in this area, for people who are living with chronic health conditions, or people who have the power to make lives better for workers, particularly those with chronic health conditions and disability. And so I want to ask you my favorite question to ask guests, which is just why do you do this work broadly?
Yeah, it's a great question. I appreciate this. So, as I disclose in my book, I was diagnosed with a serious chronic health condition, multiple sclerosis, when I was in my mid 20s. So, this was during graduate school. I was getting my master's. I was in an internship. It was basically right when I was starting my career. I had lived with symptoms for years prior to this. So, essentially, my entire working life has been with a chronic health condition. And I've experienced all different kinds of cultures and people who are supportive and unsupportive. And I've been lucky enough also to have the privilege to manage people who have shared with me that they live with chronic health conditions and disabilities. And so, all that is to say that I have lived experience that sparked my interest in this topic. Having said that, I did not set out to study this specific topic during my PhD. I got here kind of by happenstance. My graduate program at the University of Connecticut, where I got my PhD in industrial organizational psychology, they had just started a training grant program through the National Institute for Occupational Safety and Health when I began my studies there. And I was able to get funding for studying topics related to occupational health and employee well being. And I was looking for a topic I could make a meaningful contribution to. I noticed that in my classes, there was basically nothing on disabilities, there was nothing on chronic health conditions. So I looked to the research literature and I found that there was almost no research on this topic. And so I decided to do my dissertation on chronic health conditions stigma at work. And I've continued studying this topic, amongst other topics, for about 15 years since. So I wrote this book to try to get these ideas out there. It was really sort of a labor of passion in that way. And, I've heard from folks, and I agree with it, that these ideas will take some time to get traction. But change is sort of an incremental process. And my hope is just to raise awareness of these issues a little bit.
Well, absolutely amazing work, amazing book. And I'm just so glad that we as a field have you. And I think that you are the change that we need to see. And so lastly, where can people find you and where can they buy your book?
Yeah, thanks for asking me. I'm on LinkedIn, Alyssa-McGonagle, or I know my last name is hard to spell, so you can just even Google it. It'll probably correct it for you. You can get the book at Oxford, Amazon, Barnes& and Noble, Books A Million. If you order it from Oxford, there's a discount code, AUFLY30. That's AUFLY30 from Oxford. I just checked Amazon. It's on sale at Amazon too. So thank you so much.
Awesome. Thank you so much, Alyssa. Bye.
Bye.
Healthy Work is a podcast written and executive produced by Keaton Fletcher and Mariana Arvon. This episode is produced, mixed, and edited by Keaton Fletcher. Artwork is by Keaton Fletcher. And our music is Zero, Microsong by Steve Combs. Please like us, follow us, and subscribe on whatever podcasting software you use. And please leave a review on the iTunes Store. It really does help get us out there.